Hi everybody, my name is Ryan Castleton and I am a nurse. And I am currently enrolled in a class entitled Community Health. And this is just an assignment from that class. And what I would like to do is share with you what I have learned and what I've gotten out of this class. Okay. Now first, what is new about community nursing for me? I've learned so many new and important things about community nursing and community health. I've learned that there's just such a big need for community nursing, and personally, I believe it's the way that we can help our current situation. There's so many people in need, so many people or communities in need, and it's the community nurse that can assess and access these communities. Okay. Two, there's a plethora of opportunities for community nursing. The options are endless. Okay. And three, not only is community nursing for the treatment of patients, which it is, okay, but it treats them in a holistic view. Okay. Not only the ailments and diagnoses of the medical field, but also, social, economical, all these things are taken into consideration when assessing the needs of a patient. Okay, um, and it's also, excuse me, fourth, um, providing education. Okay, one of the biggest things we are lacking in our communities today is education. People are just uninformed and either don't know where to go, what to do, what it means. Okay, and as nurses, we can provide all of those answers. Okay. Um, Fifth, the assessment of communities. Okay, there's so many communities in need, but even if people recognize it, right, they don't do anything about it. A community nurse is able to assess and then act, okay, and then intervene. And again, the nurse, the community nurse, just serves the patient on a broader view, okay, and just having a holistic mindset, okay. So it was also asked, what will I do differently after taking this course, okay. And so one of the first things I thought of was how to use social media, right, to get points across, okay. Today and age, we have the internet and all sorts of social media in order to have a voice. And for a long time, okay, I just went to work, all right, at the hospital, did my job, and came home and was a regular Joe. I understand that as a nurse, I have a responsibility to share my education, to share education with others, and social media is a great platform to do so and to reach a lot of people. Okay, just increase my service as a nurse. In local races and local care facilities, many different opportunities. Just increase my participation in those service. Join ANA. That's kind of simple and straightforward. To keep informed. Keep informed with the local issues of my personal community. All right, and how can I help? Okay, and then the last one is that I'd like to do is to share the resources. There are so many resources, which I'll talk a little bit later about, that I had no idea were available. Me personally, as a nurse for 5 years, didn't know of these resources, and so if I didn't know, how are these people who are homeless and don't have access, or are health illiterate, um, how are they going to know these resources? Okay, and so one other thing that I can do is know and share my resources, right, and the resources within the community. Last topic I want to talk about is just how did my community resource knowledge increase? Okay, I just touched on that a little bit. I, to be honest, I was kind of embarrassed when we did a specific assignment asking about the various resources within our community. and realized, wow, there are so many resources available. Okay, and we wrote out a list of the things that are available, and so I'd love to keep that with me. Um, and just a few of them include the drug and alcohol treatment centers, humanitarian aid, uh, different clinics, cost-friendly dental care, elder care, and many others. Okay, and so overall, this class has been a fantastic, eye-opening experience where I've learned a lot, and it's also taught me that, you know, community nursing is what I think the future, and is something that I can be doing even as a hospital nurse. Um, I can be a community nurse as well. I can influence other people, and I can help many communities. Thank you so much. I appreciate you listening.